Hi, I'm Raina Morgan with iHealthTube, visiting with Dr. Aaron Katz, the author of Prostate Health, and we've been talking a great deal about prostate health. One of the things I wanted to ask you, Dr. Katz, is, all right, a scenario. A man comes to you, he's been diagnosed with cancer. How should he proceed? How does he live with this diagnosis?
Well, this is a situation that men struggle with every day, and it's something that I see every day in my office at Columbia University. The 65-year-old male that comes in with early stage prostate cancer, his PSA is still under 10, he had a biopsy, he has a small focus of prostate cancer, and the choices are, does he have treatment or no treatment? And if he has treatment, the conventional treatment, does he go with surgery, radiation, or cryosurgery? Or does he just watch this cancer? And in the past, we used the term watch and wait. I don't like that term, frankly. I think that if we're going to take men with early stage prostate cancer and watch them, I recommend a list of supplements and dietary interventions and a concept that I think that we termed at Columbia active holistic surveillance, which means incorporating the diet, incorporating the supplements, monitoring your PSA every 4 months. And then I routinely will do another prostate biopsy, usually in 18 months, to make sure that the cancer within the prostate gland hasn't changed, and making sure that the PSA hasn't changed. We can't always rely, as we were talking about earlier about PSA, on the PSA alone. But I think we need to look at the male as a whole, look at his PSA and his biopsy, but also look at him in terms of how is he doing with urinary symptoms, how is he feeling, what's his energy like, what's his urinary symptoms like. And so all of these things can make this type of a decision that men have to make a difficult one. But I think it's important that men get educated. I think it's imperative that men seek advice, a second or a third opinion from other physicians. And if they're thinking about radiation, let's say, they should seek the advice of a radiation oncologist, other urologists, so that they feel very knowledgeable, because all of the treatments, even no treatment at all, even the active holistic surveillance, has a risk and a benefit. You know, you say, well, what's the risk of active holistic surveillance? The risk is that the cancer could grow. The benefit is that perhaps we could spare you radiation and surgery and spare you those dreaded side effects like incontinence and erectile dysfunction.
Okay.
So it's not an easy decision to make by any means. But I think by writing this book, I tried to help in this education process, help educate men so that they can learn what would be the right treatment. And as we were talking earlier, I think it's very important that they integrate not only all of these things in their diet and nutrition, but also integrate their loved ones, their family members, and
that would
their
be very
spouse
important, wouldn't it?
to come in and learn about these different treatments and learn about the stage of disease that the man has. Because not only can it have a physical effect on you, but there's also the psychological component that many physicians forget about when you're diagnosed with cancer.
Now, are we talking about the early stages of cancer and what you just described?
Yes, we're talking about men that have this early stage prostate cancer. Their PSAs are still less than 10 usually. They have what's called a Gleason score, which is how aggressive the cancer is, which is on the lower end, Gleason 6 or less.
Okay, well, thank you very much, Dr. Katz.
Thank you.